At each public conference, the consortium has had the privilege of recognizing an individual or organization for making exceptional contributions to the fight against Alzheimer's and related diseases, the patients and their families who have been affected by these diseases, and our community. This recognition is in the form of the John Theobald Memorial Community Service Award, and is given in memory of our founding chairman of the board. John, a lawyer by background, was key to bringing our first 7 institutions together. Imagine getting 7 institutions and knowing some of them. Imagine some of those institutions agreeing to terms and principles, including how to manage IP. Pretty amazing. And he loved what we were setting forth to accomplish here. He would have been so proud of what the organization has done. He would have been so pleased by the quality of the recipients of the awards in his memory, and he would be simply amazed, tickled, as he would say, about this year's recipient. This year we had the distinct honor of giving this award to one of my heroes, Mr. Jerre Stead. Jerre is one of the most successful business leaders in the world, starting up and leading numerous companies, including some of the most successfully publicly traded companies. He and his wife, Mary Joy, who is also with us today, established the Stead Foundation, which has to date granted more than $400 million to healthcare, education, and faith-based organizations that promote compassion and understanding. And in 2023, capitalizing on his spark for launching businesses to support these similar goals, he and Mary Joy established Stead Impact Ventures to contribute to the community with those startups, some of which are also benefiting us in the fight against Alzheimer's and related disorders. These 2 deeply caring individuals exemplifies what it means to give back to the community, not only with their generous donations, but in their advocacy, support, involvement, and inspiration to numerous stakeholders along the way. The strategies in which they have invoked to get people to work together, to give them the courage to think in bold and impactful ways and take chances that we're not commonly used to, has been a difference maker in everything they do, and we have been beneficiaries in the fight against Alzheimer's disease. Jerre, among other things, chairs the Banner Alzheimer's Foundation. He and Mary Joy spearhead the effort to find effective Alzheimer's prevention therapies as soon as possible, and they're especially committed to providing the medical and family and community services needed to address the many needs that patients and family caregivers have. As just one example of that recognition, at Banner Alzheimer's Institute, our Stead Family Memory Center, we were reminded of what our goal is each day when we think of our shared goals with them. Were it not for Jerre and Mary Joy's bold commitment, without their strategic investments, there would not be a field of Alzheimer's prevention research today. That took a bold investment to convince NIH to come in with support after bold philanthropic funds, and then with that support in hand, for us to be like Tom Sawyer getting the companies to pay to paint the fence with their drugs and much larger contributions to take a risk in evaluating prevention therapies when there was no clear FDA approval pathway for prevention therapies. Now we have billions of dollars spent on prevention research, and we have a chance to find those prevention therapies. That's very important, but that's not the main reason we want to recognize Jerre and Mary Joy today. They have had this commitment to families every step of the way. And Jerre and Mary Joy, who grew up in Iowa, first became passionate about Alzheimer's disease following the diagnosis in Jerry's mother, Anna, who lived with this illness for 14 years. They were taken by the care they received and wanted to be sure that others would have the same kind of care, and created a memory center in Grand Rapids, Iowa, and many other programs along the way, in addition to all the other things that they do. They are one of the largest and most generous and insightful supporters of the National Alzheimer's Association, not only with their funds, but encouraging other stakeholders to make in-kind investments to support common goals. And a lot of those funds have gone to providing support and care for patients and family caregivers. They are deeply committed to the idea that we need a new standard of care for patients and families inside in Arizona and around the world. And they've given us the opportunity to make a difference right here in our state. In addition to their philanthropic contributions, Jerre, through those startup companies, has at the moment at least 4 startup companies that are making contributions in this space as well. A company related to blood tests, which I have a conflict I'm involved with, a company with regard to eye tests for different neurodegenerative disease, a company related to providing tools for resources for patients, family caregivers, and professional caregivers, a company related to the development of treatments that bolster the connections between brain cells in the face of neurodegenerative diseases. Just a few ways in which they continue to seek to find to make a difference. For Jerre and Mary Joy's many contributions, the Alzheimer's Association gave them their highest recognition, the Jerome H. Stone Philanthropy Award for Alzheimer's Research. And I remember being at this Alzheimer's Association International Conference where Jerre is speaking to 5,000 researchers. And Jerre is Jerre. He reminded everybody about the need to address this terrible problem, improve care for patients and family caregivers, and find prevention therapies as soon as possible. And you could see the common sense of purpose he inspired in the crowd as he spoke. Today, we're delighted to give Jerre the 2024 John Theobald Community Service Award for his extraordinary contribution to the fight against Alzheimer's disease in Arizona and around the world, improving the standard of care for patients and family caregivers, and giving us the chance to find effective prevention therapies in the next few years. Please join me in thanking and congratulating my dear friend, Jerre Stead. Just hold this for a second.
This is wonderful. Mary Joy gets all the awards. I just do the work. So actually, that's not true. It's the reverse. But thank you so much. That's great.
Should I bring that down?
Yeah, please. It's a great pleasure to be here with you all today as our common cause and common purpose. One thing I haven't talked a lot about was I first learned about Alzheimer's almost 50 years ago. My aunt Bev I was in a hospital room with my grandmother in 1974. She was passing, and it was great to be there with her. And my Aunt Bev, her only daughter, was asking me if I saw butterflies in the hospital room. And I said, no, I didn't. Turned out it was so interesting and a great education for Mary Joy and I. She ended up in a mental hospital in Normal, Illinois for 3 years. We didn't know she'd had early Alzheimer's. We learned afterwards. Her husband was actually the pastor that married Mary Joy and I. And we learned afterwards, because he did have an autopsy done, that it was Alzheimer's. And it was a great education for all of us. And I'll never forget visiting her in that mental institution thinking, this is so bad, this is awful. And so that got us really started. And as Eric just said, my mom also ended up with Alzheimer's. We went through, I was on the National Alzheimer's Association board for 3 years. Started 4 different local locations over the years for the Alzheimer's Association. Huge supporter, as Eric said, and will continue to be for all of you and for all of us together as we are closer than we ever hoped to be. And I think Eric's being conservative today with the words he's using on where we're going to be in 2 to 3 years. And it's the most exciting thing that we've ever been privileged to be part of. And every one of you make an enormous difference every day with your assistance and your help. One of the things we've spent, as Eric said, when we set up the Banner Alzheimer's Institute, we had 3 goals. One was to find a prevention before the next generation. And we're right on track with that. And that's so exciting. Every day when I wake up, I think, how do I help great people do great things? And especially, how do I help great people focused on Alzheimer's do great things? And every day I know that we're that step closer than we ever hoped to be for many, many years. And I believe that we'll be able to come back here, if you can all find your ways back to this room at ASU. I believe within 3 years we'll come back here and we're going to have that prevention. That's part of what makes the blood testing that Eric mentioned so important, because we'll need a way to manage that whole system when it happens. I also believe that all of our efforts, whether it's Alzheimer's walks or investments or volunteers, are all going to be able to focus then on doing something that is so exciting, which is stop Alzheimer's forever, everywhere. And that's going to happen. That's going to happen during our lifetime, and there's nothing more exciting than that. In the interim and then going forward, it's critical that we also do what we've worked so hard with the Banner Alzheimer's Association, our Institute, and others, and that's provide ever better education and help for the patients and their families. It's so critical. My dad was a norm almost. Dad died of a massive heart attack after having been a caretaker for Mom for 7 years. You may know that about half the permanent caretakers pass before the patients do with Alzheimer's. So that's been so critical for us to be able to provide the tools and the training so that people can have a place to go to, people can go to and ask for help. And Mary Jo and I have been blessed to send many friends that have gone through that to BAI and to see the results of it, and it's been incredible. What Eric mentioned, that happened to be in Toronto when we were recognized, and it was a great meeting, and I did enjoy my 15 minutes in front of that group, but I've never seen a group. There's 5,000 scientists in that room, all focused on what we want to see go away. And then we spent the next 3 days there seeing that group was going to make it happen. And we see one of the things that Eric laid out as one of our 3 goals was cooperation. You see it here in Phoenix, you see it in Arizona, and you do see it worldwide now. That's what's so exciting. Cooperation and working together to stop a disease that creates death and to stop it cold with prevention. One of the things Mary Jo and I were recently talking about was our honorary chairman, that Eric will remember, was Sandra Day O'Connor. And Mary Jo and I sat with her actually the day we did the ribbon cutting for the BAI's building. And she told the story of how she had taken her husband every day for 3 years to be cared for when she was still active on the Supreme Court, and to be cared for by assistants and secretaries every day for 8 to 10 hours, and how she will be, from that, said it was so incredibly important that we make sure that we provide the tools that we now do. Interesting side story you may have read. She passed, as you know, this last year with Alzheimer's herself. But it was so interesting. Her husband fell in love, quote, with another patient. And Sandra Day said, that's okay. The guy I married is not this guy now. And what we have to do is make sure none of us have that issue in the future by finding a prevention. And Eric may remember this, but there was one meeting that, a dinner meeting when we had, I think, 5 or 6 of the largest pharmas together. And I was sitting with her, he was with the Pfizer CEO, and he was explaining to us how he was going to make sure he found a drug that slowed it down. And if you ever wondered how good a Supreme Court justice she was, she stared at him, those gray eyes flashing, said, find a prevention. Don't make us all suffer. Find a prevention. And that, Mary Jo and I've carried that ever since. Eric carried it from the very beginning. And just think, I'm willing to buy you all lunch 3 years from now when we're back here if we haven't found that prevention, because it's going to happen. We're there. It's the most exciting thing we've ever been a part of. And in closing, I'm going to buy you lunch 3 years from now because we did do it. So thank you very much.
All right, thank you so very, very much. We appreciate your words and your comments.